Hello, this is Dr. David Greene, CEO of the TEX-PAIN Network. Today's topic is the top 10 ways to avoid the need for a joint replacement. Over 1 million joint replacements are performed every year in the U.S., and hospital stays entail average stays of 2 to 4 days. With the knee, the average age is 70 years, 60% are women. The infection rates are about 1 to 2% now. There is a small risk of a blood clot. And satisfaction rates are very high, and 85% of artificial knees still work well after 2 decades. Joint replacement is a quality of life procedure. You don't have to have one. If you don't, arthritis is not going to kill you. Because the implants do not last forever, it is advisable to wait as long as possible to undergo one. The implants are made of titanium, cobalt chrome, stainless steel, ceramic material, and the plastic parts are polyethylene. So the first option to avoid a joint replacement is activity avoidance. If the activity hurts, either don't do it or do it less. Such as if you're an avid runner 4 or 5 days a week and it's starting to kill your knees, start to cross-train a bit. Do some running, switch from running to swimming, or maybe some cycling, things like that. Option number 2 is over-the-counter medications. These include anti-inflammatories such as ibuprofen, naproxen, maybe some Tylenol, and then these chondroceuticals called glucosamine and chondroitin. Prescription medications may include topical prescription pain creams, higher dose anti-inflammatories, Celebrex, and then for exacerbation, short-term opiates can be a good idea, just not long-term opiates. Option number 4 is a TENS unit. These are battery powered, about the size of an iPod. They put in a low dose electrical stimulation through the foam pads that go on your skin, and they can change the way the brain perceives pain, so they are a pretty convenient way of relieving pain. Treatment option number 5 is weight loss. Less joint stress means less potential damage to weight-bearing joints. Tens of studies have shown this. Losing weight with exercise may strengthen up the muscles around the arthritic joint, lessening pain at the same time. Physical therapy does a little bit of the same. Strengthening muscles around the joints will take pressure off the joint. Modalities such as ultrasound and electrical stimulation can help relieve pain. And stretching is also crucial in therapy. Acupuncture is a lesser known treatment that has huge benefit. There's been so many studies looking at acupuncture for arthritic joints, and they routinely show significant benefit. Steroid injections have been a gold standard in the treatment of arthritis for decades. It's actually never been proven that steroids damage joint cartilage in humans. They can be given every few months as necessary. Remember, they're a proverbial Band-Aid. They don't alter the course of the disease at all. They just provide excellent pain relief. Hyaluronic acid injections, they're made from rooster combs. They were FDA approved back in the late 90s. Our joints do contain significant HA naturally. It's basically the motor oil lubricant in our joints. The theory is that providing HA for pain relief also promotes formation of cartilage. Some studies show anywhere from 65 to 80% good to excellent results for over 6 to 12 months. Those studies are the basis for which the FDA has approved their use. So now there's multiple brands. There's Synvisc, there's Orthovisc, and there's Hyalgan, just to name a few. Regenerative medicine injections are the newest player in the arthritis market. They are called regenerative medicine because they offer the potential to repair, regenerate the damaged cartilage and tissue. PRP therapy involves a simple blood draw. It's then spun down to concentrate the platelets and increase the growth factors. And then after it's injected, it calls in your stem cells to help heal. And then stem cells injections involve either bone marrow-derived, fat-derived, or amniotic fluid-derived material injected into the problem area. And those have been showing great results in small studies as well. Most patients are able to delay or avoid the need for joint replacement. While most joint replacements end up fine, there's always a chance of complications. It's a quality of life procedure, and the implants are not meant to last forever. Knee injections, incidentally, have over 75% good to excellent results with the various options presented. The top non-operative pain management in the Dallas-Fort Worth Metroplex area is through the TEX-PAIN Network. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.